And, mainstream medicine is just behind the times, and they're realizing now that every specialty is going to have a regenerative medicine aspect of it. And that's the way it is. The question in my mind is, and I don't know the answer, is it going to be one specialty or is it going to be just a portion of each specialty? I have one little saying that I tell when I do some lectures: cells, not doctors, heal patients. And how we manipulate the cells is really how we manipulate your health. We don't get you better. The cells get you better ultimately.
I'm Dr. Esra Çavuşoğlu, and I've been living a sober life for the past 18 years. My battle with addiction drove me to seek new methods, devices, and supplements to improve my physical and mental performance, enhance my quality of life, and ultimately live healthier for longer. From my experiences in addiction recovery, biohacking, and longevity to the latest global developments, from groundbreaking entrepreneurs to expert academics, the conversations I've had over the years are now featured weekly on Soberhead Podcast. Hey biohackers, welcome to Soberhead Podcast. This week, my guest is Dr. Joseph Purita, orthopedic surgeon, regenerative medicine pioneer, and the brains behind some of the most advanced longevity protocols in the world. In this episode, you'll learn about plasmapheresis and EBO system, two most used systems by famous biohackers and longevity chasers such as Brian Johnson, Mark Hyman, and Mindy Pelz. And of course, I had my fair share. Also, different stem cell types and their area of use, how light therapy of all colors from red to blue can enhance your life, plus hydrogen gas inhalation, intermittent hypoxia, and even a preview of gene therapy targets like Follistatin and klotho. Get ready for a concise masterclass in next-gen longevity. Let's dive in the conversation. Our host for this episode is DotsUp, the space, community, and platform where creatives, experts, and entrepreneurs come together at the meeting point of continents, the Bosphorus. Follow the link in the show notes for more information about events and membership. I'd like to thank Georgetown University and Gedik Foundation for their trust in Soberhead Podcast. With their support, it is possible for us to bring you this content at this quality for absolutely free. And of course, every single one who has subscribed to this channel. However, a huge amount of people who watch Soberhead frequently are not subscribed. So, I will ask you for a quick favor. Hit that subscribe button now, because when you subscribe, it helps us make the show better and provides better access to the world-leading experts. Subscribe and share if you like. And I promise to continue to bring you a better Soberhead every day. Welcome to Ayık Kafa podcast, Dr. Joseph Purita. I'm so honored.
Well, the feeling is mutual. Thank you so much for inviting me here. And the hospitality in Turkey has just been beyond belief.
Thank you so much. This is a very interesting situation for me. Normally, I would sit where you are and you would be where I am. And I didn't want to miss the opportunity to interview you and experience this swapped situation. Welcome to Soberhead Podcast again. You're such an esteemed orthopedic surgeon, but on top of it, more importantly, a regenerative medicine for over 20 years. And I'm sure you saw so many different cases. You see how the field is progressing incredibly. Probably like every day, you guys are coming up with new treatments, and especially with AI, it's getting better and better. Today, I want to focus on a couple of topics that I already did these treatments. One is plasmapheresis, plasma exchange therapy. The other one is EBO or EBO2, which I think it's your creation with light. I also have a huge request from my audience to focus on light therapy, whether full body light therapy through the vein, or like you guys do on the EBO system, that the last circulation goes through these lights and gets back into the body. So welcome again. Which one would you like to start with?
You're the host. You make the decisions.
Okay. So let's start with, I don't want to say most aggressive, but I would love to start with the plasma exchange therapy. The reason is that we see nowadays in very influential people's Instagram account that they did it, like Mark Hyman, Brian Johnson, Mindy Pelz. They're all holding these yellow bag of plasma, which I did as well. Actually, I think the whole system was first created to help blood disorders. Many times I tried to do it in Turkey. Unfortunately, I couldn't because they were only doing in hematology centers in Turkey in the hospitals. So what is plasma exchange therapy for longevity? And actually, before even that, what was it normally? What were the conditions it was used? But now, how is it migrated into the longevity field?
Well, that's an interesting question. And plasma exchange is becoming more and more popular because we realize that there's certain growth factors that are bad growth factors that we cannot remove with other technologies. These growth factors get trapped, so to speak, in the plasma. Mm-hmm. And the only way to get rid of them is literally throw them away. I mean, so I call plasma exchange an oil exchange. It's basically like you change the oil in your car. Now, there are a lot of different growth factors, and a lot of the research was done in Stanford University by the Conrays. Also, Dr. Dmitry Koprov, I believe his name is, that they said this is probably one of the best ways of doing anti-aging because of the fact that the results, and they did most of the results in mice, parabiosis, where they would basically transfer old blood and throw it away and then give them the young blood. And it's interesting. I would see similar cases when I was an orthopedic surgeon. Many times I'd have a patient, an elderly patient, maybe in their 80s, who had a broken hip, lost some blood. We had to transfuse them before they had surgery. And lo and behold, a lot of people would say, my father seems to be more bright than he was before he broke his hip. And just didn't think much of it until I started realizing, hey, wait, there must be some growth factors from the young people. And we know that's what it is. Now, we know that there's all sorts of exosomes floating around, microparticles, et cetera, in our blood. And these exosomes and microparticles can control our genes and tell them what to do and what not to do, et cetera. And I think that's where we're going to see some big advantages over the long stream. Eventually what we want to do is we want to start transfusing young blood to old blood. They're doing a lot of that. Actually, I believe you're in Austin, and I know they're doing quite a few cases in Austin just of that effect. We're looking into doing that also. So I think plasmapheresis is something that there's no other technique I know that can do what it does. EBO2 is one of my babies, one of the things I've helped develop. It can do other things that plasmapheresis can't and vice versa. And it cannot get rid of certain growth factors that plasmapheresis will.
I was in A4M multiple times, and actually I watched the researcher that you were mentioning showing the exchange young blood to the old blood to the young blood, and they were doing this experiments. But my question is that, at least for now, majority of the plasma exchange therapy is not done with young blood, correct?
Absolutely. And I have not done it with young blood either yet, for a number of reasons, from regulatory issues with the government, but also there seems to still be some potential for allergic reactions, et cetera, with the fresh plasma. So right now we're using albumin. Mm-hmm. We're using methylene blue. We're giving them other things. And we're also thinking of giving them some exosomes from placenta cells. We think that may be of a real good boost, so to speak. It may be a good substitute for the fresh plasma without the risks. Mm-hmm.
So can you explain how it works?
Okay, well, basically, there's two types out there. There's a filtration type, and then there's the centrifugation type. And I believe the centrifugation type is more popular and seems to be a little better as far as efficacy is concerned. So what it's doing is it's spinning the blood around, and it's separating out the plasma from the white blood cells, red blood cells, platelets, and other immune cells, etc. And then we just have that plasma go out, and it basically accumulates in either a tube or a sac, so to speak, and then we terminate the procedure after basically either 1 liter to 1.5 liters of plasma is removed. Mm-hmm. And at the same time, we're replacing it with albumin and other compounds.
Because we're losing 1 liter to 1.5 liters, some fluid, so that you replace it with albumin. What's the reason for albumin?
Well, you want to basically make sure you have what we call the oncotic pressure. You want to make sure that you're not going to pull too much fluid into the veins, because you could have somebody getting what we call a vascular overload. So we want to be able to balance the pressures in our vascular system, our circulatory system. system. Hence, that's why we have to use albumin. It's an essential part of the treatment. The other thing I like about albumin, it's a very potent anti-inflammatory compound. It seems to be very good that way. And one other thing I want to say about albumin, people might say, yeah, but it's a blood product. I'm concerned about getting a virus. Albumin is sterilized. It's pasteurized. There are no viruses in it. You don't have to worry about that.
As a side note, I was at A4M last December, and there was this Russian lady that told me it has nothing to do probably with Turkey, and I'm not even sure if it's a correct information about United States, but she said that most of the albumin that they're using in the United States are coming from China.
Could be. I don't know. But I sort of doubt that. I would think a lot of it is collected by blood banks and then processed. I know there's a lot of donation centers in the United States that are sending it, so I can't see that they would send it all the way. But it's possible. I mean, if it is, I suspect it's probably undergoing, strict regulatory issues to make sure it's properly manufactured.
So you said about there are two different devices. One is with filtration and the other one was with
Centrifugation. Spinning it around.
All right. So what makes one different than the other as an end result? Is there a difference in the end result? And what's the experience of the patient on the other side?
Well, so what's the difference? Well, filtration, think of like a car. A car has an oil filter. It filters the oil, but I still think some bad things are still going to maybe escape the filtration. Whereas centrifugation, you're literally taking it out and throwing it away. So you're not going to have these things hanging around. Now, you're not going to basically throw away all the plasma. That could be dangerous, but you're going to throw away a good portion of it. I think each has their benefits. I think eventually, in my mind, what I'm working on maybe is to do both centrifugation and maybe filtration afterwards to see if we can really do the 1-2 punch, so to speak.
The experience of the patient, the client on the other side, is it different? Because I know that there's one coming out from one arm, getting into the other arm. There's another one that comes out like the ozone pass, kind of go through the machine and come back in.
The ones that we're using, basically it's one arm. Okay, the blood goes in and out the same vein, which is good. Now, sometimes we will put a second IV in to basically start giving albumin, because albumin has to be given very slowly. It can't be given fast or it can cause some cardiovascular problems.
So the two machine then doesn't have a difference?
Not really. Again, it's the technique that's done, but otherwise they're not that dissimilar.
Let's go back to what's thrown out from the plasma, because it's very important. Because I had a very thought-provoking podcast with a doctor, Dr. Robin Rose, about long COVID. And it seems like 5 years later, this spikes protein can be hidden in the epithelial cells under the shape of microplaques. And then it's causing, strokes, heart attacks, whatnot to people. And obviously there is the cholesterol, unfavorable cholesterol, inflammation, obviously, heavy metals and whatnot. So if someone want to do a plasma exchange therapy, what should be their expectation? And it will be helping people from what ranges, like the mild case to a severe case?
I think it would help all cases. And again, now when I'm talking about plasma exchange for that type of patient who's had some COVID problems, I'm not going to just do a plasma exchange alone. Actually, I've had a protocol that I've made where I first will do EBO2, wait a day or so, then I'll do plasma exchange and another EBO2. And each has its benefits. That's why I would do it, because I think it would be a much better way of doing it. And we can get into that, whenever you'd like.
Yeah. So, but then let's talk about the plasma exchange therapy. Help me to understand, because I see people sharing like, oh, I'm like 2 years younger, 5 years younger, my system works better. So what would be the real purpose of doing it?
Well, first of all, when you talk about, I feel so much younger, I'm younger, to me, aging is a mosaic. I mean, to say on one test that you're 5 years younger, it makes no sense to me. But anyway, what would be the benefit? The benefit is, again, we're getting rid of toxins and bad growth factors. We have growth factors that are both good and bad. We have interleukin-1, interleukin-6, tumor necrosis factor, which really like to hang out in the plasma, among other things. They're released by basically the immune cells. They're released by other cells in the body. And we have no way of getting rid of them. And senescent cells will also release them. So this is one good method of getting rid of those things. Yes, they will build up over a period of time. But again, maybe with better lifestyles and other modalities, we can basically keep that at bay, so to speak. So that's why we want to do the plasmapheresis, getting rid of those, especially those 3 growth factors, which are bad growth factors.
And what is normally a suggestion to a, let's say, healthy person to do? Like how many times? Like a few times a year, a couple of times back to back?
Well, you hit it right on the head, a healthy person. I would say probably maybe do 2 over a course of a week or 2 weeks, and then maybe repeat it in 6 months to a year, something like that, depending on what the patient wants to achieve and basically what his finances are somewhat also.
Yeah, sure. That's an expensive process. But, you know, I think health is wealth, and a fair amount of people started shifting their approach to wellness and health. Instead of buying a very expensive purse, they started choosing doing these type of therapies because, you know, a purse is not going to give you any type of a health. So let's now come to EBO, because that's an interesting system. It's super popular, obviously, in America. It's almost like, you know, I don't want to say every corner, but it's very easy to find a center that are doing EBO systems. Let's first start with what is the acronyms are standing for?
Okay, so EBO2 means extracorporeal, meaning outside the body, blood oxygenation and ozonation. So basically, we're running blood. Basically, it's being pulled by from one IV by a pump. It then goes into a dialysis filter that is reversed. It's upside down. That is where the ozone gas will then mix with the blood. Okay. Now, no ozone ever enters the body because as soon as that ozone and blood mix, ozone gets converted to a couple of other things, including hydrogen peroxide, oxygen, and many other things. Another thing called lipid oxidation products. Then the blood goes to a hemolumin machine, which basically subjects the blood to 6 different color lights: red, blue, infrared, green, ultraviolet A, and ultraviolet C. But more importantly, another big innovation that we've made to this is we now pulse it. We know in the biologic world, pulsing lights are much more effective than continuous lights. Then the light goes back to then the blood then goes back to the patient via the other arm. So that's one of the things. And I just want to say one other thing about the hemolumin machine. We are also now using that with plasmapheresis. So when someone gets plasmapheresis, the blood is then running through this machine again, getting photoactivated. And realize one thing, the circulatory system is a superhighway for your immune system. So anything we can do to improve that is a very important thing.
I did both, actually. I quite didn't understand what was obviously collected in that plasma exchange therapy bag with the yellow fluid, which you just explained. But my experience with EBO2, I did 3 sessions, 1 a week. I had an interesting waste collection, let me put it that way. The first time was a light pink with foam. The second time was darker pink, kind of closer to get a red fluid with more foam. But the third one, then it was like a light yellow with very little foam. I did some research around that because I was curious why it was like that, but it seems like the second time seems like pulling out more waste. Can you please explain what these color means and what's the explanation of that foam?
Sure. Very good questions. All right. So first of all, you must realize, and some people say, wait a minute, I'm living such a good lifestyle. I'm doing all these biohacking tricks. And why do I still have a bunch of foam? Well, one very important thing we have to realize, as we age, we have more and more viruses in our body. Viruses that we had as children, CMV, Epstein-Barr, they become more numerous. And remember now, viruses can cause inflammation. Inflammation causes aging, inflammaging, etc. So we know that basically we can eliminate a lot of viruses through 2 methods. First, the ozone gas, as soon as it comes in contact with a virus, can damage its lipid envelope. It now allows its DNA and RNA to be exposed. And exposed DNA and RNA is not very healthy for the virus, so that helps eliminate it. Secondly, we have ultraviolet A and ultraviolet C light. Now, ultraviolet A is more of a cell stressor. We can get into that a little bit for heat and cold shock proteins, but ultraviolet C is very toxic to organisms. And most of the other most other types of machines do not use ultraviolet C. They'll use ultraviolet B, which is very damaging to all cells. Ultraviolet C, because of its finicky nature, is basically damaging to viruses, as mold, limes, etc. So that's what we're seeing. Now, we also have some byproducts from the immune system cells, and one of the two things we have in there is called beta-2 microglobulin. Now, beta-2 microglobulin basically is, we think, eliminated from some of the immune cells and things like that. And what it seems to do is it seems to basically produce a compound called negalase, which is an enzyme that basically disables some of our macrophages. So we're seeing that also. And it's basically the first time you go out, a lot of times you'll see there'll be a large accumulation in the ball, and you're probably getting some hemolysis and things like that, perhaps, of some red cells.
What does that mean?
I'm sorry, hemolysis means some of your red blood cells are just lysing, and they can give it a little tinge. And then there basically may have been cells that basically were old anyway, and, probably a good idea to get rid of those. And we're actually in the midst of, as we're talking, we're going to be, as I go back to the United States this week, we're actually going to be doing some laboratory testing on that further. So another thing that we can talk about, down the road, so to speak. So, and this is very typical. The first time we do something, we'll see a lot of foam and some pinkish. Then the second time it'll be less. And by the third time, it's very little foam and some liquid in there. And basically, we're tuning up your immune system. Now, remember, hydrogen peroxide, which is made by the ozone, is a very potent stimulator of your immune system. And the better we get that immune system working, the better and healthier you're going to be.
The foam is like the inflammation, maybe? I don't know, like...
It's sort of a marker of inflammation.
Okay.
Now, but realize one other very important fact with EBO2 is that it's stimulating something called the NRF-2 pathway. Now, what is NRF-2? NRF-2 is what we call a transcription factor, meaning that it gets into the nucleus of the cell and it gives the cell nucleus instructions, the genes, to make certain compounds. It's a very potent anti-inflammatory transcription factor. I have a saying that I tell my patients: think of your body, your organs and your cells as the computer hardware, and these pathways as their computer software. And when you have a problem with your computer, what do? We reboot it, and that's what we're attempting to do, reboot some of these pathways. Another important thing with EBO2 is when it's done properly, it can really profoundly affect your blood glucose levels and make them go down. So there's many times we'll have to give patients D50W intravenously because the glucose is going down.
While doing the procedure? Well, here's the thing. They gave me a bunch of sugary things to eat, which I kind of didn't want to, but in order to keep my blood sugar at a certain level.
Right. That's exactly it. I mean, I kind of shun at the thought of giving someone juice, but yet you need to, because if it's done properly, your glucose is going to start dropping many times.
Then let's talk a little bit about, for people who watches this and they kind of end up going to a center, what is not the right way to do? What can be wrong when they experience versus right?
Okay, well, one thing, some people may, quote, get an ozone treatment, and it's something called a 10-pass.
Yeah.
Now, here's one of the problems with a 10-pass, and I'm going to just give you an idea here. When you look at a 10-pass, what it means is you're going to take some blood out, you're going to take it with a syringe typically, you're going to inject it into an IV bag, and then you're going to inject ozone in, and you're going to shake it up. Well, you're going to have an interface maybe about 4 or 5 square inches.
Sure.
Now, with EBO2, you're going to have an interface in that dialysis filter of about 22.5 square feet. So right off the bat, you can see the efficacy is tremendously bigger. Okay. The other thing I see sometimes out there is the amount of ozone, what we call gamma, kind of the strength of the ozone, so to speak, is very low in some of these machines. Now, in the biologic world, we have something called a hermetic effect, and it affects everything that we deal with. What does it mean? It means a certain concentration is very beneficial. Even if something's toxic, a very small concentration probably won't affect anything, and a large concentration can be deadly. And one of the things I'll give you that most people don't realize, you cannot survive without carbon monoxide. Believe it or not. If a very small dose is very beneficial, and it's the hormetic effect, because it can do many profound things in the body. A large dose obviously is toxic, and anything much smaller than that's not going to work. So that's what we see there.
I also heard, and actually some of my audience sent me some strange videos about when people were doing, now that we're speaking about ozone therapy, if the machine is not manufactured in a high quality place, equipment, material, and if the plastic that these, tubes, getting into the machine in and out, ozone is such a potent gas that would melt that. Obviously, it's not going to melt like fully, but it can carry some microplastics.
You're exactly right. And that's why you have to have certain tubing that's basically designed to be used with ozone gas. Now, the one thing I will say is, remember now, these tubings are only a one-time use. Mm-hmm. So many times it's probably not going to matter, but we'd rather err on the side of caution by using tubings that are, basically ozone-proof.
All right. You touched based on stem cells, and I know that you've been using stem cells for now a couple of decades almost, starting
Correct.
with your orthopedic surgeries. There's also a huge debate in the field, like whether it has to be your cells or exosomes from an umbilical cord. Some others says something else. Let's dive into these cells that is being used for treatment. So what's your take? Do you think that at 50, let's say take me, 53-year-old person's their own cell, autologous cell, would be helpful?
Absolutely be helpful. I mean, I've been using autologous cells for 20-something years now.
All right.
And there's some reason there. Now when we start thinking about cells, the one thing we have as we get older, it's a numbers game. Now, for the audience, you must realize out there, I use 3 sources of cells. I use some from the blood, not much, but there's a V cell that I'll use. We could talk about that. But I do use a lot of adipose. Now, adipose is very rich in mesenchymal stem cells, but I also use bone marrow.
Adipose would be from fat?
Adipose and fat are same thing, yeah. And I also use bone marrow aspirate. Now, one must realize, just putting stem cells in an area is not necessarily going to do anything long range because cells work as a symphony. You need not only stem cells, you need macrophages, you need microparticles. Realize also, I use exosomes on all my cases. Why? Because I'm using autologous exosomes from my marrow and sometimes from the blood. Platelets are a very big contributor to exosomes in the body and microparticles. So now getting more to your course, what's better, your own cells or someone else's? Well, another thing that we're realizing now in the field of regenerative cell therapies is we think that maybe one of the ways that the cells are working is they're transferring mitochondria. Mitochondria basically the basis, as far as I'm concerned, of most all diseases. When all's said and done, mitochondrial not working properly are basically going to give you problems. So we know that these mitochondria, if I use autologous cells, there's not going to be a problem because remember now, when you basically are born, your mitochondria DNA comes from your mom only, not from your dad. But if you start putting mitochondrial DNA from another source, a lot of the literature says those mitochondria maybe are not going to work that well and not going to last that long. So I think, my experience has been when you use the allogenic cells, I think they basically will give you a better pop, so to speak, as far as doing immune modulation, meaning that we're going to kind of quell some of the inflammatory responses of things. But in the long term, I think, autologous are going to work better. Now, my suggestion for somebody that really wants to go to the real extreme to really make it work well is you basically, what we're doing is we'll take some adipose tissue, we'll send it to a laboratory, they'll break it down, they'll extract the mesenchymal stem cells, and they'll culture expand it. One more important thing I want to mention is we have to realize that, unlike what most of the people are saying that are doing allogenic cells, these cells are not immune privileged, meaning the immune system will attack them. They are immune evasive. So eventually they will be attacked and they will have a problem with your immune system potentially.
So you touch based on that V cells. I heard about them. It seems like there are the embryonic-like cells in your own system.
Correct. That's exactly what they are. They're called very small embryonic-like stem cells. We extract them from the blood. We then have to basically put them in a environment of about 4 degrees centigrade with very low oxygen overnight to stress the cells. These cells, and they're similar to something called a Muse cell. They basically
I know Muse cell.
Yeah, they basically get turned on by stress. Then we give them back the next day intravenously. Now, we're also mixing it with a platelet lysate. What I mean by a platelet lysate is we will take the platelets, we will crack them open so that they can be given intravenously. Because if you start giving platelets back intravenously, it's not going to do much, first of all, but it could potentially cause clots. But in our way of doing it now, the other thing we do is we basically photoactivate these with a red light.
So basically, you prefer to use the person's own material, but you also says it's a matter of the quantity. Therefore, do you mean that if you're going to do a treatment, whether intravenously or locally, if the person is 30 years old, the amount of stem cell that you're going to be injecting or putting it through the IV would be less potent than the person of 53 years old that you're collecting?
Well, most likely that younger person's going to have more cells than the older person. But again, fat, the number of cells don't really diminish that much in fat as far as the bone marrow. That's the problem.
Oh.
See, the bone marrow is the one that you get trouble with because as you age, the number of mesenchymal cells in your bone marrow goes down dramatically. But hematopoietic basically rise somewhat. Now, I must admit, when I'm doing cell therapies, I don't really care about the age of the person so much. If I'm doing an intravenous therapy for an autoimmune condition, much more important, and I'd be much more inclined to try and do cell expansion for that because I think that's going to give you the best chance of success.
What do you mean cell expansion? What does that mean?
Again, I would get your cells, I would basically extract the mesenchymal stem cells, send them to a laboratory, and they will expand in numbers tremendously into the millions and millions.
Mm-hmm. I also heard that one should only do, let's say, I think they were talking about passes. If they do like 10, 15 passes, then it's going to be a lot, but not as potent.
Well, not only would they not be as potent, but here's what I get concerned about. You know, when you start doing too many passes, you may start getting some DNA damage. And there's some suggestion that perhaps some of these cells could go on to some bad lines, such as cancer lines. So typically the bank I use is called American Cell Technology. They basically will not go more than about 4 or 5 passes. And that's a very safe way. And that pretty much is supported in the literature.
I also heard from another guest of mine, Dr. John Lawrence. We didn't speak about stem cells with him, but in a private conversation that we were having, he said that he was using fat cells because they last longer in the system. It's not like the blood cells that's like kind of, it get in and out, whatever, fix the problem, but it seems like fat cells are more durable. Is there such thing?
Well, first of all, you can't really put fat cells intravenously.
Oh, okay.
Because fat basically would give you an embolism. He probably is talking about mesenchymal stem cells. Now, realize when these cells are given intravenously, they have to pass through the lungs. Mm-hmm. Okay? Yeah. Most of the cells basically get trapped in the lungs. Mm-hmm. Now, they undergo a process called apoptosis. Mm-hmm. Apoptosis basically meaning they die. But what happens, these cells then converted into other things. First of all, they release a lot of growth factors. But also, they get converted into another type of cell called a T-reg cell, T-regulatory cell, which is a very long-acting cell that can last for basically years, and it can really knock inflammation down dramatically. So that's probably the reason why we're getting it. And so when all is said and done, the cells that are given intravenously probably are not lasting that long, but they basically are contributing some of their mitochondria, like I say, and they're also converted into T-reg cells.
I see. Maybe he was doing more local healing.
Could be.
Now let's kind of merge into these light therapies. I've been doing light therapies for a while now. I have a Juve machine at home. I had it for the last 6 years now. Obviously, I don't know exactly the wavelengths of these systems, but they keep being improved more and more. I know that you are also an expert in these. People are asking a lot. When you Google, you start getting these Instagram ads and stuff like, you know, this light, that light, the other light. There's a cap, there's a this, there's a handhold device, there's a big device. Then there are the IVs and so on and so forth. Let's first start with what is light therapy, red light, near-infrared light, and it seems like there are other, I don't want to say colors, what do you call it?
Wavelengths. Same thing. Yep, same thing.
Yeah, wavelengths. But let's first talk about the ones that people are using recreationally, because probably they're more curious about that they have more access to that.
Sure. Most of the lights out there that people are using are typically in the range of red light, okay? It'd be red and infrared. Now, what makes a color is what we call the wavelength of the light. So basically, in the red light range, it's around 630 to 650 nanometers, and that basically is what the wavelength is of the light. Then you also go a little further down the road, so to speak, and you have infrared. Now, each has their benefits, okay? Now, the whole field of light therapy is called photobiomodulation, meaning that lights can basically affect the biology of the tissue. Now, one of the things that it really does, and again, as I said it earlier in our little discussion, the mitochondria. And one of the things that light therapy does, especially red light therapy, is it can tremendously activate the mitochondria and make them produce more ATP. ATP is the body's energy currency. Now, if we can get technical, what they do is it starts affecting what we call the electron transport chain, where basically NAD works and things like that, where it basically supplies electrons to eventually the mitochondria to produce ATP. Now, light therapy attacks one part of, I shouldn't say attack, that's not the right word. It stimulates one part of that chain where we have a coenzyme called cytochrome C oxidase. Mm-hmm. And when that gets activated, it can dramatically help the ATP production by the mitochondria. Mm-hmm. So that's a very important aspect of things.
And there's also near-infrared light. Is it doing the same thing?
It is, but guess what? Near-infrared actually penetrates deeper. So that's why it may have even better effect. The best red light you can get is one that has red and infrared combined, because then you're getting a lot of good stimulation.
So there's no side effects, there's no danger for someone to do it every day?
Not at all. I cannot, and I mean, I really looked at this subject, all angles of it, and no, there's no problem whatsoever.
I know that you and fair amount of practitioner uses red light to activate, like you said, NAD, stem cell, methylene blue. Why is that? What is it doing?
Well, okay. Now, first of all, I don't think there's that many people that are actually using it to activate NAD and methylene blue. That's actually our own technology that we've devised, okay? Photoactivation therapy, where basically we're taking our compounds like NAD, methylene blue, curcumin, a couple of other ones. We're taking it from the pharmacy, we're putting it into a little machine that we've invented. We're in a syringe and we're photoactivating it for 3 minutes, pulse light, and then we're putting it in an IV bag and giving it to you intravenously. For instance, our NAD, we can cut the time it takes a patient to do NAD by about 70%. We basically photoactivate it with violet and red light. We do methylene blue, we activate it with red light only. Again, methylene blue, it basically transports some of the electrons to the mitochondria. But also when you photoactivate methylene blue, it can have a profound effect on viruses in the body, and we think even cancer cells.
I didn't mean that, they're using IV. I meant they're suggesting when you take not even a pill, drops or some other type that is dissolving in the stomach, that they're asking people to, let's say, half hour later, if you have a red light panel, to do it, or if you're in their center. Yeah.
Right. Absolutely. But we've taken it to the next level.
I know.
That's the next step in there.
I know that, but it's not easy always to do things through IV.
No.
Yeah, so, sometimes it's easier to, if someone is practicing these at home, that's why I'm trying to help them as well. So if they take a methylene blue, having a red light after the fact, it's like kind of more enhancing the activation.
I'll tell you a very practical story that basically is close to my heart. We have a little Shih Tzu dog that fell from our bed, had a spinal cord contusion. Basically, its back legs were paralyzed. We took her to the vet, and the vet said, well, she's going to recover. We had to do an MRI, but it's going to take her many months. So I got a hold of a good friend of mine who's a vet and a stem cell scientist, PhD, and we put our heads together. We put her on some enzymes, and I had a handheld red light, infrared light, and at 15 days, she was walking. My wife took her to the vet and said, I don't know what your husband's doing, but have him keep doing it. So red light and infrared light is very beneficial for most injuries. Any stem cell I do on a patient, they get treated with red light and infrared light.
Let's talk a little bit about your center, and I know that you're also advising to Only Health as well, but you have so much more equipment. What are the systems that you're using at Pureform? Which is where you're based to begin with. Let me ask you that.
Yes, I'm based in Pureform in Boca Raton, Florida, about 1 hour north of Miami. Okay, so what do we do there? Well, we do some of the similar things that other centers have. We have whole body cryotherapy, we have contrast therapy, we have infrared saunas and things like that. One thing I'll bring that may be of benefit to the patients out there and your fans, we also, when we do our contrast therapy and things like that, we use a medication from Australia called Selbex, Selbex.
Oh, I heard that name, Selbex. I think also they have in Japan. help me to understand. Sandra Kaufman is using it.
Right. Well, she heard my lecture at the RadFest on Selbex.
I'm going to be recording with her on May 1st.
I gave a lecture on heat and cold shock proteins, for 30 minutes.
All right.
And that's where I mentioned that. And it is a very good compound to use. So we use it all the time.
Hold on. I'm very interested to that now. Please let me understand.
Okay.
So contrast therapy, meaning if the person is doing sauna or cold cryotherapy or cold bath.
Right.
And then you give at the same time the Selbex,
yes,
the medication?
I have a regimen that I made. Now, for those that aren't familiar, there's what we call heat and cold shock proteins. A better name for them is stress shock proteins because they basically are derived from various stresses to the body. But what do? Which is very important here, is they will basically help proteins fold properly into the cell. Now, misfolded proteins are the cause of many different diseases. And think about it. If your proteins that are going into your mitochondria misfold, that's a very serious problem. So the more you can basically make these things work better, such as stressing like heat and cold with the Selbex, the better you're going to be. Okay, let me then follow up with another question, because I also always like to do the shortcuts, like that's what you mean, like biohacking means. Exactly.
How she explains is that she doesn't like to do cold or hot, but she straight up take a Selbex. Would that work? Well, like I said, heat and cold shock proteins are kind of a misnomer because it's stress shock proteins. You're going to get the same thing from intermittent hypoxia. You're going to get the same thing from EBO2. It really can benefit almost anyone. And it's an ulcer medicine from Japan that it is. All right. The machine NanoV, they're doing the protein folding as well. I've heard of it. I don't know all the ramifications of it. Okay. Yeah, that's what they say, that proper folding of the proteins, because if the body cannot shred it and throw it away, then it starts accumulating and then starts causing troubles. Exactly. We were talking about systems that you're doing at your center. Well, we have the plasmapheresis, obviously, which we use with the hemolumin. We also have EBO2. Another very favorite of mine is hydrogen gas therapy. I'm really very happy with that. I like hydrogen gas. Why? For a couple reasons. First of all, hydrogen is a very light element. We use it by breathing it in. Many times we'll do it when someone's getting an IV at the same time. Now, hydrogen gas is a very potent antioxidant, anti-inflammatory, and it can get into all the nooks and crannies of the body. Now, one important aspect of hydrogen gas is this. Most of your free radicals originate in your mitochondria. The problem is many of your antioxidants, such as vitamin C, etc., are too big to get into that mitochondrial membrane, too big to penetrate. Hydrogen gas can. So it can be a profound effect on your mitochondria. The other thing I always do at the end of the session that the patient has, I will have my nurses bubble some hydrogen gas into a little bottle of water, and then I have the patient drink it immediately. Yep. Here you go. But I'm telling you, I'll do the same thing. And then basically the reason why that's good is because there's some good literature out there that says hydrogen-enriched water will basically have some very good effects on your gut bacteria. So that's important. First thing you said you do with it, like dripping? A lot of times I'll have patients breathing in hydrogen while they're sitting there getting an IV anyway. So I said, let's kill two birds with one stone. Yeah. I did a recording with Paul, Eco Hydrogen Water's founder. And how she explained it is that, drinking it, good enough. Yeah, you can breathe, but drinking it also, you take a fair amount of hydrogen in your system. Right. But the problem is with most hydrogen water, unless you make it right away and use it right away, hydrogen is going to leave. The other thing I'm looking at, and I'm trying to find a source of it, is deuterium-rich and deuterium-poor hydrogen water. Hold on. What are they? Deuterium-rich comes from, World War II, when we were in the United States, we were working on the atom bomb and we needed a certain type of hydrogen that was a little heavier isotope of hydrogen. But we know that the lighter isotope of hydrogen can have very profound effects on the whole body. I'm trying to find a source of it, and I'm talking to someone to see if we can get a source of this deuterium-poor hydrogen water. Dr. Purita, obviously, all these machine systems, everything is wonderful for people who can afford and who have access. But I listened to a couple of podcasts that you were a guest. You have your own 2 cents about the lifestyle. So let's give some advice to our audience that, what they should do first before reaching out to all these, plasma exchange, this, that, and the other.
Okay, so basically, I try and practice what I preach. So I think lifestyle is probably the most important thing.
Mm-hmm.
Machines can't make up for a bad lifestyle. Mm-hmm. Sorry, but, I don't want to disappoint anybody. So, my day, for instance, I get up and I'll go walk every day 4 miles. Mm-hmm. Then I'll go on my elliptical for 25, 30 minutes, and I'll get my heart rate up to the 140s. Then I'll go swimming. That's basically phase A. But I also do intermittent fasting, 18 hours a day, 5 days a week. During the weekend, I cheat. I also take a handful of supplements, what I think are some good supplements that I take. And I do an occasional IV, and I do some other treatments. My other treatment that I like to do in my office that's not that expensive is intermittent hypoxia. I think that's very, very important to do. And it's fairly inexpensive compared to a lot of other modalities that are done.
So not the hyperbaric oxygen chamber, but the intermediate one. So it's ups and downs.
Yeah, basically I'll go from 9% oxygen to 40% oxygen. Mm-hmm. Just sitting in a chair. Mm-hmm. Sometimes my patient will be doing an IV at the same time they're doing that. That's probably one of the best stimulators of mitogenesis, meaning making more mitochondria, than anything I know of. And also, if you look at the Israeli study for hyperbaric oxygen, where what the Israelis told us is they say, hey, if we do a hyperbaric chamber treatment of an hour, and every 15 minutes we take the mask off for 5 minutes, that change of oxygen concentration to the body really has some profound effects. And they literally showed a good scientific study that they increased the length of the telomeres. But this will do the same thing, intermittent hypoxia, and it's probably a lot cheaper.
So I have a question to you, actually, for me to learn. I know that VO2 max measurement is very important as a longevity marker. So first of all, do you guys do any type of measurement?
No, we don't do the VO2 max there. I think VO2 max is important because it really gives you a good picture of how your mitochondria are functioning. I think that's the importance of it.
You are in Istanbul. Let's speak about that a little bit. I know that you are in the advisory committee of Only Health.
That's correct.
Yeah, what I know is that's the only true biohacking longevity clinic in Turkey, because there are many small ones, they only have, let's say, IV and cryotherapy, not much else. So you come often to Turkey, I guess, to give trainings to their doctors?
That's correct. We were the ones that helped them get established with certain modalities that they have in their office. And, the door is always open. If they have any questions for me, they can get a hold of me by, contacts, email, WhatsApp, you name it, they can get a hold of me. So I'm only a phone call away.
I think you just also gave lectures to their clients.
That is correct. I did some lectures on various modalities that we do at Pure Form, and and how basically Pure Form and Only Health kind of sister clinics with each other.
That's wonderful. So I have audience in Turkey and in America, and because I am a dual citizen, I also have many Turkish friends who lives in America. They can try both places. There are many people in Miami. So where do you think this longevity medicine is going? Because you saw the past, and it's very quickly accelerating.
With AI now, it's unstoppable. And, mainstream medicine is just, they're behind the times, and they're realizing now that every specialty is going to have a regenerative medicine aspect of it. And that's the way it is. The question in my mind is, and I don't know the answer, is it going to be one specialty, or is it going to be just a portion of each specialty? Orthopedics, cardiology, pulmonary, etc. I think it's going to be kind of a combination of both, and we'll see how it goes. Here it is, as an orthopedic surgeon, I'm doing things that I would have never thought 15, 20 years ago. Doing things about ozone and this and that. I would say, well, why am I doing that? But I realize the importance of it. I have one little saying that I tell when I do some lectures: cells, not doctors, heal patients. And how we manipulate the cells is really how we manipulate your health. We don't get you better. The cells get you better ultimately.
Yeah, you're right. That's a wonderful saying. Before we end, I have one more very important and personal question. What do you think of gene therapies? I did recently a Follistatin gene therapy. And actually, the reason I did it, because I just had a surgery, and they told me that obviously after surgeries, you're not able to work out. I have a fair amount of muscles, and I passed my 50s, obviously, and summer is coming. And I'm like, you know what? let me do it so that at least I would not lose my muscles. But now we have, like, I guess, Follistatin gene therapy. There's some places are doing klotho gene therapy. What's your take on them?
I think that's the future. No question about it. You know, the whole field of genes and epigenetics is really what's going to make our field become in the forefront of everything. So I think these are, they're the beginnings. I mean, how successful are they? I'm not sure. I think they work. I think for klotho protein, I think you can do a lot of things to stimulate it as it is, but I think I still am very interested in doing basically the gene therapy, and I may consider it myself one of these days.
Yeah. I would love to hear your take and I can share my own experience because it's going to be an interesting experiment. I did the DEXA scan just before doing it. Then I didn't do any workout and I came to United States, had my surgery. And I guess in 2 months before starting working out again, I do another DEXA to see if I lost anything or if I built anything by just walking around.
I'll give you one little hint, though, that may be of some benefit for your audience. And it's something that's not expensive. I'm not sure if you're familiar with blood flow restriction therapy.
Oh, yeah. Katsu.
That's the Japanese method.
Okay.
But what I'm talking about is basically you have specialized blood cuffs, blood pressure cuffs, that can sense your blood pressure. And what they do then is they can create some localized intermittent hypoxia, which will dramatically increase myostatin blockers, increase HGH, etc., IGF-1. And basically, you're not really spending a lot of money on it, and it's a great way to work out. It works very well.
Well, thank you so much for your time. I know that's your last night in Istanbul. I really would hope to see you in person. Hopefully, you come back to Istanbul or next time I come to United States. And thank you for all your wisdom. And we'll put all the details about Pureform to the show notes. And whomever would like to reach out to you, whether the Turkish people that want to have more information to feel more safe to do certain procedures, or they just want to come to your clinic because you're one of the leading experts in this and you're, I'm sure, much more cautious than other doctors that want to do everything.
Well, thank you so much. It's been an honor being part of your program. I really look forward to seeing you again. Thank you.